good morning and welcome to another Ministry of Health virtual media conference which provides you with the information on the Ministry's COVID-19 response. Today we have with us the Honorable Terrence Deyalsingh, Minister of Health, Dr. Roshan Parashram, Chief Medical Officer, and Dr. Michelle Trotman, Thoracic Medical Director at the Cora Hospital. I'm Candice Alcantara, Manager Corporate Communication at the Ministry of Health, and I will be your moderator for this morning's media conference. I invite the CMO now, Dr. Roshan Parashram, to provide the clinical update.
Hi, good morning, Ms. Alcantara. Good morning to the Honorable Minister. Good morning to Dr. Trotman. Good morning to members of the media, members of the viewing and listening public. So I'll begin with the update as of the 25th of February 2022. This is update number 1011. The number of new positive cases over the last 24 hours, 638. Deaths reported over the last 24 hours as well, 5 persons, and condolences to the families of all of those persons. Total active cases now stand at 21,384. Total persons in hospital at this time, 305. And that is both hospital and step-down facilities. Just to break down a little further, the hospital, so 243 persons in hospital, 81 at the Cuba Hospital and Multi-Training Facility, 11 in ICU, 8 in the High Dependency Unit. At the Cora Hospital, 26 persons, Augustus Long, 38, St. Anne's Hospital, 10, Arima General Hospital, 45. There's no one at the New Point Fortin Hospital at this time. St. James Medical Complex, 33, Scarborough Regional Hospital, Fort King George, 10. And at Scarborough General Hospital, Signal Hill, no one. In terms of our step-down facilities, Claxton Bay, no persons at this time. UE Davie, 19. UTT Valsine, 11. Point Fortin Area Hospital, 26. And at the Tacarigua facility, there are 6 persons. In terms of the further breakdown of patients by vaccination status, again, fully vaccinated from July 22nd to 2nd of February, we have 2,543. which accounts for 16.5%, and those not fully vaccinated, the lion's share, 12,860, accounting for 83.5%. And just to remind, these are persons that would have come into hospital or stepped down during that period. The last graph, total deaths by vaccination status, 230 persons fully vaccinated who would have passed away up to this point in time, 2,924 as well as 390 persons not fully vaccinated during that period as well. And this accounts for approximately 93% of the persons who had passed away are not fully vaccinated. So Candice, that's my brief update for this morning.
Thank you very much, CMO. And we go now to Dr. Trotman, who will give us a presentation this morning on tuberculosis.
Good morning, Minister Deyalsingh, Dr. Parashram, CMO, Alcantara, members of the media, members of the listening and viewing public, and most importantly, members of the healthcare team. It's my pleasure today to deliver some words on tuberculosis and COVID-19. First slide. Next slide. Tuberculosis is a disease that has been around for many years. It affects a significant portion of the world's population, and in fact affects more than 25% of individuals all over the world. Now, that doesn't mean that you have active TB. As you can see in the slide, there are 2 major forms of TB: latent TB and active TB. TB itself, in both forms, can be caused by a bacteria, the name of which is Mycobacterium tuberculosis. When someone is exposed to that bacteria, they can get TB in the form of latent or active TB. Latent TB, as the table suggests, has no symptoms. So you get exposed and you don't have a cough or a fever or something to say that your body has been attacked by this bacteria. Active TB, however, you do have symptoms, And those symptoms can stem from a cough, to a fever, to night sweats, to weight loss. The important thing to remember here with these symptoms, though, is they tend to be over a period of weeks as opposed to days. And we'll talk about that a little bit more when we look at symptoms of TB and COVID-19 together. People who have latent TB usually cannot spread it to other people. Those who have active TB, if they have TB in their lungs, and the lungs are the organs that are most affected by TB. If you have TB in your lungs and you cough, or you sneeze, or you spit, you can spread TB, which is why cough hygiene is so important for patients who have TB. We tell them to cough a particular way, and we expect that that will help to control the spread of TB. Latent TB patients, as I said before, don't actively have TB compared to patients who have TB that we call active and they have TB. Most of the TB in the world is concentrated in maybe 8 countries in the whole world. They are more in the Western Pacific countries like China, India, Indonesia, Nigeria, etc. But it is everywhere and can be in the form of latent TB or active TB. The good news is that both latent TB and active TB are curable. I want to say that again. Both latent TB and active TB are curable, and of course we can use antibiotics as it is caused by a bacteria. Next slide, please. We are going to look at some statistics, but to put it into context, since 1997, the WHO has published a report that is referred to as the Global Report for TB. And it looks at the incidence of TB across, at this point, over almost 200 countries, 198 countries, and looks at particular characteristics of TB. So if we look in the table below, from the global report coming out of 2020, which would have reflected the figures of 2019, there were more than 10 million cases of TB. In Trinidad, that same year, and actually in 2021, we had 181 cases of TB. Globally, to date, COVID-19 has attacked more than 430 million people. COVID-19 has now upstaged TB, which used to be the #1 cause of death from an infectious point of view worldwide. In Trinidad and Tobago to date, we have 126,000 plus cases of COVID. Looking at the deaths, TB has caused 1.5 million deaths. In Trinidad, in 2021, we had 27 deaths, and COVID to date, more than 1.4 million deaths. Next slide, please. Just to comparatively look at the figures, 2020 to 2021, we would have had less cases of TB reported at 181 compared to 242 in 2020. This table also gives some information of the total number of TB cases with diabetes and with HIV. Why is this important? Because we know that TB tends to be in certain subgroups, subcategories of illnesses. And TB and HIV are 2 of those subcategories of illnesses. I am happy to report that the ministry has put together programs where we now have collaborative programs working with both diabetes and TB to address, with diabetes and HIV to address TB. So the total number of cases we had with diabetes was in 2020 was 18, and in 2021, 24. Total number of cases with HIV, 30 in 2020, and in 2021 with TB, 17. You'll see there's also a male distribution. More so for TB, there are more males affected than females, both in 2020 and 2021. Next slide. TB and COVID. Very interesting, some of the symptoms that we see with both TB and COVID. And I would have listed the ones that are similar. So cough, both TB and COVID, shortness of breath, fever and fatigue, both TB and COVID. Caveats though, cough with TB tends to be productive and can be blood-stained. Cough with COVID can be productive, but often more dry. Patients with TB tend to have weight loss, less so than patients with COVID. Patients with TB tend to have night sweats, less so than patients with COVID. On the other hand, as you know, patients with COVID can present with diarrhea, loss of taste, sore throat, etc. They are both spread by droplets. Interestingly enough, they can both be detected by PCR testing, but in addition, we can use sputum tests, and of course, we use the nasal and throat swabs for COVID-19. Other comparisons. As I said in the beginning, TB is caused by a bacteria, COVID is caused by a virus, and everyone knows that's the severe acute respiratory syndrome coronavirus. 2. Let's look at prevention. Very interesting. Both TB and COVID-19. Our 3 W's are there. Isolation, mask wearing, hand hygiene. Both TB and COVID-19. We have very effective drugs, that I said before, that can be used to cure TB. And we can also use vaccination to help prevent us from getting TB. Medications, as we know, that are available for the treatment of TB include the steroids and some other medications. Vaccinations are available for both. I want to take this opportunity to encourage all again to vaccinate. Vaccinations for TB is in a specialized group, only in special populations. But vaccination for COVID-19 available to all unless there is a contraindication. Our TB COVID-19 statistics for Trinidad and Tobago. To date, we have had a total number, next slide please. To date, we have had a total number of 17 cases of COVID-19. Next slide please. And of those 17, we've had only 1 death. Next slide please. What we have noticed clinically with those patients with TB and COVID-19 is that they present with similar symptoms, but their symptoms of TB tend to predominate, meaning that they tend to have that cough that is bloody or blood-stained. They tend to have weight loss accompanying their presentation, and unfortunately seem to take a longer time to clear their COVID-19. This is one subgroup of patients that we would often swab because they often have to go back into the hospital traditional care system and would require a negative swab to do so. And what we find is these patients can take 4 weeks, 6 weeks, even longer to go from COVID positive to COVID negative. They often have accompanying diseases, as we said before, as with TB, with diabetes and HIV. Next slide. Next slide, please. Some interesting facts to know about TB. TB patients by themselves, they are not at increased risk for COVID-19. But when they get it, they can have more severe symptoms and especially poorer outcomes if their treatment is interrupted. So those who have TB, we want to continue their treatment unless there is a specific reason why we should not do so. Next slide, please. Some other facts. Latent TB and COVID-19. Again, no increased risk for COVID-19. The actual TB medications and COVID-19, it's okay. Go ahead and take your medications if you have COVID-19. As mentioned before, if you don't, we tend to see poorer outcomes. TB and COVID-19 both have stigma applied and attached to them. Unfortunately, people who have TB, they themselves are anxious about having TB. The way that people also approach them, they sometimes discriminate against them, either at their workplace or in their own homes. This mounts another level of anxiety. Coming out of this, feeling stigmatized, feeling anxious, these patients often don't present themselves for medical care, or if they come later than they should. I want to encourage all that if you know someone who has TB, that we try to avoid stigmatization for these patients, as it has very far-reaching effects. Most important, TB, both latent and active, and the COVID-19 vaccine. In both cases, it is safe to receive the COVID-19 vaccine unless otherwise stated by your physician for some other reason. If you have active TB or if you have latent TB and you are offered the COVID-19 vaccine, it is okay to take the COVID-19 vaccine. I just want to end on the note of World TB Day. World TB Day is, next slide, is celebrated every year, March 24th. There was a Dr. Robert Koch who would have identified the bacteria on March 24th, stated that he knew that this was the bacteria for TB. And since that day, we have been celebrating World TB Day. We use that day to raise the awareness of TB to the public, letting them know about the severe health, economic, and sometimes social associations with TB. We have some targets to reach that have been set by WHO to end TB in different forms by the year 2035. And we are hoping as a department to use the World TB Day to get all involved in helping us to reach this target. We would like to continue to save lives, and the actual theme of World TB Day is that we save lives by investing to end TB. I thank you all. I want to please encourage all to practice the 3 W's and also to vaccinate.
Thank you very much, Dr. Trotman, for those points of clarification between COVID-19 and tuberculosis, and of course the reminder about vaccination and the 3 W's. Very, very important. They continue to be important points. And we'll go to our final presentation this morning from the Honorable Terrence Deyalsingh, Minister of Health.
Thank you very much, Candice. Good morning, Chief Medical Officer, Dr. Parasram, and welcome back, Dr. Trotman. Haven't been here for a while. Welcome, and thank you for a very informative presentation on TB and COVID. I certainly learned a lot again. Good morning to ladies and gentlemen of the media and all persons listening and viewing wherever you are. I'll just give you briefly the vaccination numbers as to where we are. So those persons who are fully vaccinated, 702,682, which is about 50.2% of the population. So we are crawling there, slowly but surely. Numbers fully boosted, 134,873. So we are boosting about 1,000 persons a day, which I welcome. The schools drive, which started on Monday, again, disappointing. We have done about 38 students so far. As we know, I want to deal with the issue of the Pfizer vaccines and the expiry dates. As you know, the Pfizer vaccines that we currently have in stock will be expiring on Monday, the 28th of February. We expect our first tranche of 75,000 sometime next week. We had a meeting with the authorities on Thursday, and it is going to come in sometime next week. As soon as we have flight details, we'll of course let you know. So what we have to do from Tuesday, the 1st of March, is temporarily suspend our Pfizer vaccination program. So all the centers have been alerted, all the county medical officers of health, all the CEOs, and we'll be pulling stock back from the system from around lunchtime on Monday. So we are just alerting the public that from Tuesday, the 1st of March, no Pfizer vaccine will be administered anywhere in Trinidad and Tobago just for a couple of days while we await the 75,000 that is coming in. A very detailed press release will come out today, alerting the public about that, and especially for our pregnant women and so on, what they can do. The booster program will continue because you can be boosted now with anything. You can be boosted with Sinopharm or J&J. So the booster program doesn't stop, but the first and second doses of Pfizer vaccines will be temporarily suspended for a few days. The number of those vaccines that we will have to then destroy will be about 260,000, as I indicated a couple of weeks ago. So that is what we will have in our hands, that we will have to which we will have to incinerate. So that will be the method of destruction, incineration. They don't go to any public dump or anything like that. It will be on a process of incineration. We have been asked, and we got the figures. We promised to get them on Wednesday, the total number of vaccines by brand given out, and we have it now. Sinopharm, across the range of first doses, second doses, boosters, and so on. We have done 897,805 of those. AstraZeneca, across the range, first dose, second dose, additional primary dose when that first started, 241,167. Pfizer, again, across the board, first dose, second dose, additional primary dose, and then booster, 328,444. And J&J, 56,339. So that is where we are with our vaccination numbers. And again, just to alert members of the public that no Pfizer vaccinations will be given out from Tuesday, just for a couple of days until the new shipment arrives. And as soon as we have details on that arrival, as we normally do, we will share it with the public. Okay, thank you very much, Candice.
Thank you very much, Minister, for that very important update on COVID-19 vaccination. We go into our question and answer segment. As usual, media representatives, our panelists are here to respond to your questions. Please state your name and the name of the media house that you represent before posing your question. Please, no more than 2 questions at any point in time. And if we have time, we will come back and field some more questions from the media. We begin with AZP News. I believe you are the first in line to pose your questions this morning.
Hi, good morning. Suan Weil from azpnews.com. My 2 questions are to the Minister. Recently, this week gone, a global biomanufacturing hub has been established in Korea to assist countries who are not first world to be able to manufacture their own biologicals, such as vaccines, cancer treatments, etc. Has Trinidad and Tobago engaged in any such discussions, yet with who, to be a part of this training? And my second question is also in relation to that. Apart from the training that persons will be able to receive, do you think that Trinidad and Tobago has the capacity to produce such? If yes or no, why? Thank you.
Thank you. So, on the first issue, we have not been engaged in detail on that. And just repeat your second question, please.
If we have the capacity.
We have the capacity to produce such. If yes or no, why?
No, currently there will be no capacity to do that. To set up a vaccine manufacturing plant is a very detailed process. And many small countries like us do not have that capacity. The major manufacturer of vaccines in the world is India, the Serum Institute of India. Not only for COVID, even pre-COVID. They were one of the major vaccine manufacturers in the world. Small countries like us typically don't have that capacity. Okay? Thank you very much.
Thank you very much. Let's go to Newsday newspaper at this time for the next questions, please.
Morning, Glenn Chantak of Newsday. My questions are, my first question is, could we give the public again a reminder as to the rules regarding the operations of areas which are designated as safe zones, be it private sector for these carnival events and so on? Because it ties into my second question, which is based on those particular rules as they are for safe zones. Is there a concern that public health regulations were breached with respect to two particular events? One was a concert at the Queen's Park Savannah on Thursday just gone, and the other one was, I believe, the Canberlay event, because we have images of crowds and it doesn't appear as if the rules are being adhered to in these areas. So could we get some answers on these two areas, please?
Thank you. So the operation of safe zones and the conditions to be applied are clearly listed in the public health regulations about masking, except if you are eating or drinking. Only vaccinated persons are allowed, and so on and so on. The actual responsibility for the operation of a safe zone lies with the owner/operator who is carrying on the event, and the responsibility for the administration of the public health regulations lie with the Trinidad and Tobago Police Service. So I think I have given you some answer from the Ministry of Health perspective what a safe zone is. You only allowed vaccinated persons, masking except when you are eating or drinking, the capacity at 50%, but the actual operation of a safe zone is the responsibility of the owner or the person who has control over the premises, and the implementation for any breaches lies with the TTPS.
Thank you very much. Thank you, Minister, and thank you to Newsday. ACP, we have a follow-up question from you at this time. So let's go to ACP News again, please.
Hi. Minister, in response to your question, to the first question that I asked concerning the training in Korea, even though we're not in talks with WHO yet, do you think that Trinidad and Tobago can benefit from such an initiative, even though we may not have the capacity at the moment to produce our own vaccines?
Thank you. So there's always a benefit to be involved with training at a technical level. And we will look at it when the opportunity comes to us. But as I said, we have not received anything very official yet from WHO. But if something comes and it is applicable to our local situation, we will certainly take advantage of that opportunity.
Thank you, Minister. And as we just give the media some additional time to pose some questions, I just want, as usual, to highlight, please, our weekend vaccination. We take every opportunity that we can to encourage persons to go out and be vaccinated. So we have vaccination in the east up until 3 o'clock at this time. We go to Costat, El Dorado up until 3 p.m. if you want to get vaccinated, and Larry Gomes Stadium. That's a walk-in and a drive-through, and that's available until 3 p.m. At Sapa, you have about a half an hour again. They close at noon. And UTT campus in Chaguanas, they operate until 3 p.m. And of course, the paddock would have closed its operations this morning as we started the conference. So still many ways for you to get vaccinated. Let's take a follow-up question from Newsday. We'll go to Newsday for a follow-up question at this point, please. Are we ready with Newsday?
Yes, I'm here. This is tied into my second question a little while ago, and basically I wanted to ask as well. I mean, how often do we review the rules for the safe zones and their operations? And since we've launched the Taste of Carnival events, is there a certain level of satisfaction that those events are being managed in line with the regulations for the safe zones?
Yeah, thank you, Clint. So two things. Let me repeat. The second part of your question, the enforcement of the safe zone policy is for the TTPS/the owner. And yes, we constantly review everything under the remit of the Ministry of Health, whether it's the safe zone policy, our hospitalization numbers, masking protocols, everything. Yeah, so it's a constant recalibration. We look at all the data available, and we make decisions. As last week, we made a decision to allow the under 12s who are unvaccinated to go back in to safe zones. So there's a constant review, and just to reiterate, the application of the law for safe zones is a responsibility of the operator, owner, and the TTPS.
Thank you, Minister. And AZP, we see another question from you, please.
Hi, yes. Regarding the booster program, do you expect a drop in the booster program for the next coming days that Pfizer may not be available, seeing that it seems to be a preferred choice for the booster shot?
Yeah, so thanks. So we are currently doing just about 1,000 a day. There may be a temporary lull that is to be expected for those who prefer one brand over another. So that is to be expected. But then as soon as we get in the 75,000 shots sometime next week, hopefully we go back to normal service. And yeah, so let's hope the drop-off isn't too significant. Thank you very much, Swan.
Thank you very much. That question there from AZP News. And it seems at this time we have come to the end of the conference. We have no more questions from the media. Thank you everyone for joining us this morning. Please be safe. Continue to follow all of the personal health guidelines. And as you enjoy yourself this weekend, please remember to do so safely. Thank you for joining us.